Good morning and welcome to your weekend healthy chat. As always, I'm your host, Dr. Sara, and today we have another great show lined up for you. Our first guest is Erica Dahl, who is a high-risk nutritionist for the Port Jervis WIC office. Good morning and welcome.
Good morning. How are you?
Good. Well, we're very happy and lucky to have you on the show. So tell us a little bit. So what got you started into this field and what actually does WIC stand for?
WIC stands for Women, Infants, and Children. And the program in Port Jervis is available to women who are expecting, breastfeeding moms up to a year after they deliver, and children up to the age of 5, and postpartum women who are not breastfeeding up to 6 months after they deliver.
Great.
So it is for low-income families, and it can help a lot with groceries and other things. So.
Absolutely. And what inspired you to choose your field, the high-risk nutritionist?
I knew that I wanted to work in a science field, and I wanted to work with kids.
Oh, great.
So
I felt the same way.
Yeah. So it became obvious that the nutritional risks among children in the United States is going up. So it was interesting to me to try and work with families to help them set goals to improve the nutrition in their households.
Perfect. Now, speaking of that, what are some of the nutritional deficiencies you see with the population that you work with?
In the population we work with, a lot of times I work with kids that are picky eaters.
My 4-year-old's a picky eater, too.
I would say most kids go through at least a stage of particular eating.
The mac and cheese diet.
Yes, the pizza, mac and cheese, chicken nugget diet. We are all too familiar. But also underweight, overweight children. I work with a lot of breastfeeding mothers that are having just various concerns. A lot of times with pregnant women, we see anemia, or they're not gaining enough weight, or they're gaining too little weight, or maybe their diet is deficient in things that would help them grow their baby the best way that they can. So,
and then you help set them up with the diet that's appropriate?
Yes.
Great. Now, what are some of the things you look for when identifying nutritional risk for infants, let's say?
For infants, we would do their height, weight, and at a certain age, we do their iron levels. And a lot of times we look at different kinds of things they're eating, when is appropriate to introduce solid foods, how it's how it's appropriate, what kind of things and when to introduce solid foods, and we identify deficiencies in their diet. And again, breastfeeding counseling is really a big part of what we do at WIC also.
Yeah, what a great resource WIC is. Now tell us a little about some of the outreach stuff that's going on at WIC. So I know there's the WIC Farmers Market program. So what is that?
If you are a WIC participant, this time of year you get $24 free per family to some of the local farmers markets. So it's in addition to your food package. It's not, you don't have to substitute or change anything in order to get it. And it's checks that you can take to various farmers markets in the area, specifically the one in Port Jervis is the one that a lot of our participants go to. It's Saturday mornings over by H&R Block on Front Street.
Okay. And what time is it on Saturdays?
I believe it's 9 to 1.
Okay, perfect. And they offer a variety of different vegetables each week, or?
Yeah, we have a nice relationship with the farmer, and as the season goes on, whatever is
in season
and...
Perfect.
Yeah.
So I know I've been hearing a lot about this children's garden at WIC. So tell me a little bit about that.
Oh my gosh. The children's garden is one of our favorite projects. So this is the 5th year and it grows every year. We do something different. The kids put it in the ground at the beginning of the year. And this year we have expanded the size of the garden. And also, we've planted a couple new crops.
Oh, so what did we plant this year?
Well, in addition to our normal, cucumbers, peppers, things like that, we are growing peanuts, and we're growing corn.
Very nice.
And we're growing strawberries.
Wow.
So that is
quite
all
the variety.
New. Yeah, and we're learning as they learn with some of this stuff,
And it's
too.
so fun to see the kids' faces when they go out there. They just seem so excited.
Oh, and it's fun for us, too, because then they come back and they help water and tend to what it is.
Good.
And then as things grow and become available for picking, which we get to a certain point in the season and there's something available every day for them to pick. So we have when they come in for their appointments or just kids stop by that are part of the program, we take them out, we pick whatever is available.
Oh, nice.
We have recipes available. We do food demos when we know that things are going to be ready so parents know how to cook them. And we find that just encouraging the kids to learn where their food is from and how it's grown and be involved in it can make them open to trying new things and
a lot of healthy eating.
Yeah, and incorporating some of these, locally grown produce items that they can even then go find at their farmer's market into their diet. So
absolutely. So I know one of the new programs is called the Healthy Kids Club. So tell me a little bit about that.
The Healthy Kids Club has evolved from what was a toddler time. And what we do is it's for kids 1 to 3 that are part of the WIC program. And they come and we do an activity with the kids and kind of a lesson with the parents that's age appropriate for everybody around some of the eating issues that toddlers experience. So it's kind of a nutrition spin on a playgroup that used to exist.
Oh, very nice.
Yeah.
Very nice. And what days is that offered?
Toddler time right now is rotating.
Okay.
But if you're a WIC participant, when you come in for your next appointment, certainly ask. Just ask. We're happy to have new people as well as some of our, regulars. And then we also have a play group for kids ages 3 to 5, which is a little bit different.
Okay. And what happens at that play group?
We do physical activity. So we encourage children to get active and kind of decrease their screen time and teach the parents ways that for little or no money, they can really engage with their kids and have them participate in their environment instead of being attached to that, the iPod or the TV.
The iPad, the evil iPad. I agree. Now, I know there's a breastfeeding chat room. So can you tell me a little bit about that?
We have a whole breastfeeding program. So we found that a lot of our breastfeeding moms need not just support from their healthcare providers, but also from other moms that are currently nursing. So what we did was we call it the breastfeeding chat room. And it's a very laid back setting. We invite our expecting moms to come as well as our breastfeeding moms. And they just talk about what their nursing experience is like. I think sometimes when you are either pregnant or breastfeeding, everybody wants to tell you their horror story around it.
Right.
So this is an opportunity.
And you don't hear the good part either.
Right. So this is an opportunity to get a really honest perspective from our moms that are currently nursing and our peer counselors, who we have 3 of.
And they're all wonderful.
They're wonderful.
If you haven't checked them out, head on down.
They are just 3 breastfeeding moms that are willing to talk to you about whatever your challenges are, whether you're returning to work, whether you're trying to get a breast pump, whether, you don't know if you're making enough milk or not, or if your experience is just beautiful and you want to share it with somebody and talk, they're there. So
now, how does someone access the chat room?
It's another group that is rotating. It's monthly.
Okay.
Although you can make an appointment with any of our peer counselors anytime. But when you come in for your next WIC appointment, whether you are pregnant or whether you are currently breastfeeding, your nutritionist will probably ask if it's something that you're interested in.
Very nice. Well, it sounds like quite the amount of services that WIC offers.
Oh my gosh, it's so much fun.
Well, good. Now, before we wrap it up, what are the eligibility requirements in order to receive benefits through WIC?
Okay, for our specific agency, you have to be a New York State resident. Again, you have to be an expecting woman, breastfeeding woman, or child up to your 5th birthday.
Okay.
And there are income requirements. So some of the income requirements, like if you have New York State Medicaid, if someone in the house is receiving food stamps or temporary assistance, that can be an income qualifier.
Okay.
Or they actually raised the income standards this year. So if you're a family of 4, for example, you can make up to $120 over $44,000 and qualify for the WIC program. And if you're pregnant, you actually count as 2.
Okay.
So the expecting mother counts as 2 people in a household. So that can be helpful.
Wow. And then if someone wants to get in touch with the WIC office, how would they do that?
You can call. We are open 9 to 5 every day, except Monday through Friday, except Tuesdays when we're open 9 to 7. And the number is 845-856-8156. Or you can stop in. We're located at 140 Hammond Street over in Port Jervis.
Well, great. Well, thank you, Erica, for being on the show. We really appreciate it.
It was nice to be here. Thank you so much.
And we'll be right back after this. Welcome back. We just finished our segment with our high-risk nutritionist from the Port Jervis WIC office. And now we're going to change gears a little bit. Sitting next to me, we have Fernando Ahumada, who is the Supervisor of Patient Services for Middletown Community Health Center. Good morning and welcome.
Good morning, everyone.
Well, we're very happy to have you on our show. So let's get started. So what is your role at MCHC?
Well, I do I mainly supervise and coordinate the daily activities for the patient services for the Middletown Community Health Center. So I cover the complete region from Montgomery all the way down to Milford, Pennsylvania.
Yeah, since we have quite the amount of offices located throughout.
I got some mileage.
Now, what type of service can a patient expect when they come to MCHC?
Well, we provide the best service possible to our community. That's part of our mission statement. So you would expect that you can, when you call, you talk to somebody, you tell them what ailments or what concerns you have and what providers you want to see. So our service tries to cater to whatever the patient needs. So, and because of all of our sites, it is a convenience for them to access one of the sites that's closest to them. So,
right.
Yeah.
But the initial phone call, is that through a call center?
That's through a call center. We do have a call center in Middletown. Since we do have so many sites, they kind of man all the phone calls and they can do all of your scheduling. And if there are concerns that you need to talk to a provider, we will forward you forward.
Great.
The sites.
Now, what are the customer service standards that MCHC has in place?
Well, right now we have a training that we do. It's called, it's actually called Give 'em the Pickle.
So let's talk about that. So what does that mean?
Well, it's based off of Robert Farrell. He's a entrepreneur who has several restaurants in Seattle, and he developed a customer service training called Give 'em the Pickle. It's based on a customer that walked into his restaurant, had been going there for years, and one day the person came in, he asked for an extra pickle with his meal and was charged. And it was the first time that he was ever charged. He wrote a letter to Mr. Farrell saying he would never go back to the restaurant. He couldn't believe it.
Yeah.
So it's based on that. It's just giving customer satisfaction. There's 4 main principles that we concentrate on.
And what are those?
They are service, attitude, consistency, and teamwork. So with service, what we train all of our employees is to make servicing others our number one priority. And you're in a noble profession, so be proud of what you do and where you work. So
absolutely.
Yeah, we're in a profession that we can definitely go home every day and say, we provided the best care possible to our patients.
Right.
So it's
really making the difference.
Exactly. It's a very endearing
it is.
market to be in.
That's why I'm in it.
That's
absolutely.
right.
To make that difference.
Then we have attitude, where we tell all of our employees to kind of choose their attitude, because how you think about the customer is how you will treat them, right? So if you come in with a positive attitude every day,
right,
that emanates and emanates throughout the community as well. So if it's provides a pleasant experience,
right?
And when I say customer, we mean patients,
right?
There's tons
families.
of our families. So there's tons of articles out there now that a patient is referred to as a customer or a consumer. So because
they really do have a choice.
Exactly.
Where they go.
Exactly, they do. And I'd like to thank all of the patients out there that do come to the Middletown Community Health Center and choosing us as their health provider. So the third piece of our customer service training is consistency. So, customers return because they like what happened the last time. So stick to our higher standards. So that is something that we do day in and day out, consistency, and keeping things at a high level.
Right, absolutely.
And the last piece is teamwork. So make each other look good. Everything you do ends up in front of the customer. So
yeah, you can't stress that enough.
Exactly. So it's true. So everything from that first phone call
right
to the time that they walk out and they check out after seeing the provider. So we want to make that a team effort,
right,
from the front desk all the way to the provider.
Yeah. Now, with the increasing shortage of primary care physicians in the area, how does MCHC handle same-day sick appointments?
We actually have listened to our patients in the community and to our providers, and we are catering our schedules and blocking out times for them on a same day. So we actually started with Port Jervis because we did have that challenge with Dr. Matakis leaving the practice. Fortunately for a practice like ours, we do have several providers that do help. And I'd like to personally thank Dr. Little here, who actually has reached out and put in some long hours to make sure all of our patients are happy.
We never mind.
We never mind, exactly. So because of the demand that we've had in Port Jervis, we're starting to see a lot more of the demand in other sites. So we are taking time to
really structure their schedule.
Yeah, structure the schedule and reserve times for same day. We understand that, say a child is sick throughout the weekend, they want to come on Monday mornings. Since we are in such high demand, sometimes we, in the past, we wouldn't have any space. Right. So now we're blocking out some time in the morning and in the afternoon to cater.
Yeah, to really try to accommodate.
Yes.
Yeah, for all patients.
Yes.
Now, I've heard families say, they come into me all the time that they've been to other larger medical offices in Orange County and they're treated, quote unquote, like it's a factory. Now, they're moving patients in and out. They're spending little time with the actual patient. And I get these complaints from parents on a regular basis. How is MCHC different?
Well, MCHC, to begin with, is a non-for-profit organization, right? We're not a clinic. Mm-hmm. We do run on a small, tight margin of profit that we dump back into the organization. Mm-hmm. But what we do is we'll cater to our patients, right? So without our patients, we're nothing, really. Right. So unlike privately owned organizations that will pump their patients in and out within 15 minutes, give them a prescription and next patient. So we actually take the time. And personally, I see it on a daily basis with our front desk staff and our call center to really accommodate our patients and give them the time they need with our doctors and our nurses.
Absolutely. Which is definitely nice in comparison to some of the other practices. I get here all the time, oh, it's such a hometown feel at this office. Or, patients, tell me all the time, oh, everyone at the office actually took the time to listen, and that doesn't happen everywhere. So that makes me feel, that's great. That's such a great response when we have that.
Yep. I think that there's several studies out there that address patient services and the customer experience that, the patient will come in and they'll meet with a doctor on an average 15 to a half hour, sometimes to an hour with some of our doctors if it's a full physical. And there's theories out there that there are several layers of customer service and patient service. And it really begins with that first phone call. It's not just that half-hour experience that they have with
it's the total
doctor.
Experience
exactly.
From the time they call to the time they walk into the office and by the time they walk out. It's
exactly.
the whole experience.
And that's really what we're concentrating on. And actually, there's exciting things going on at the Middletown Community Health Center.
What are those exciting things?
We actually are up for accreditation through something called PCMH. It's a patient-centered medical home where the state actually accredits medical centers. Right. So we are getting geared up for that, and everyone's working as a team and making sure that one of the pieces of it is communication, teamwork, and all the things that we train everybody on. But it's really, what it really comes down to is building a great rapport with our community and providing the best care possible. And that's what we're looking for.
Yeah, and that's what we do every day.
Every day, day in and day out.
Yep. Well, I just want to thank you so much for being with us today, Fernando.
Thank you. This is exciting stuff.
And on that note, we'll be right back after this. Welcome back. Now it's time in our show for our email question of the week. And this mom writes, "Good morning, Dr. Sara. After playing outside this past week, my little one came in covered with bug bites, and he is really digging at them. How do I prevent them from becoming infected?" Perfect question, as any type of bug bite has the potential to become infected. When asked this question in the office, I advise two things. First, use an over-the-counter hydrocortisone cream, as well as Benadryl, to assist with both the itching and the redness. And second, for the bites that are open secondary to the scratching, apply bacitracin or triple antibiotic ointment. You want to do that twice a day, and that's really to help them prevent the actual infection. If the site starts to swell, if the redness worsens, if there's pain, or if you notice pus, make an appointment with your child's pediatrician to have them evaluated for a possible infection of that bite site. And don't forget, bug spray is key this summer, and reapply often. I hope this helps answer your question. For those of you with further questions, please feel free to email me at drsara@middletownchc.org. Again, that's DRSARA@middletownchc.org. I just want to thank our two guests, Erica and Fernando, for being with us today. So thank you both so much. We appreciate it. And I hope you have an active and healthy week ahead, and I'll see you again next time. Take care.